comfortable position. Understood what I'm preparation of the patient, saying that I'm going to give laser. It is going to help in healing of your wound. Okay? Laser should come first. Okay, so open wound. So we should explain to the patient. We should explain to the patient that I am giving laser so that it goes inside, the cells will absorb the light, it helps in. Huh? Yeah, we're just telling the patient. We should explain them because they'll think that what we are doing is good. If you just treat like that only, they'll think that they'll not have any kind of effect. Psychologically, they'll not feel good. Always we should explain to the patient in a simple way where they can understand. Because psychologically, those things are important. It's not your treatment. First you should explain, I am giving this laser. This laser is helpful like this. This laser or light comes which goes inside your skin, inside your cells. It absorbs the light. Okay? It heals, it kills the bacteria, virus. It heals your wound. So we should explain to the patient. Understood what I am talking? Next we have to select the treatment what we have to give the laser. Say he is having laser, maybe since 4-5 weeks he is having wound. Okay? And the technique of application. There are 4 techniques we have discussed in laser. Anyone is there? There are 4 techniques we have discussed in laser. What are the 4 techniques? One is scanning. Okay? One is banding. One is point application. Okay? These are the things we have checked, we have seen in the laser therapy. Understood what I am talking? So, when you are treating a patient with any kind of open wound, one of the important things, we should not touch the laser to the skin. Understood what I am talking? It's very, very important. Okay? So, when we are using when I say your patient is having open wound, so be careful, you should not touch. Understood?
Yes.
So 4 methods: grid technique, scanning technique, banding technique, point application. For this patient, for wound, we should select scanning technique. Scanning technique where the laser tip will be 5 to 10 millimeters away from the wound, where you can keep slowly scanning. Understood what I am talking? So we have to select the appropriate treatment. Okay? Before starting our treatment technique, we should explain to the patient the instructions and warnings. What are the instructions? We should instruct the patient not to touch the equipment, the leads. Okay? You should not sleep. Okay? Warnings. If the patient is not comfortable, if he is getting pain, if he is not comfortable in position, if he is having any kind of burning, because burning will not happen in this. In case, if the patient is not comfortable, he should report. So once we have to start the treatment. So this is the laser equipment. I have attached the mains to the socket. Okay, and the on button is behind the laser machine. You have to on. Okay, so it will ask for enter the code. We have to press 1, 2, 3, 4. Please, everyone come, please. Okay. Those people, they don't want? Sit. You don't, I'll ask in exam. Okay. See, this is on button. Just on. The laser machine will on. Okay. It will ask enter the code. Okay. 1, 2, 3, 4. This, okay. This is old machine. So buttons are deep. You have to press. It's very old. It's not working that properly, but I am showing for demonstration purpose. all these things have went down inside. It should be up. So little bit hard, press properly. So 1, 2, 3, 4, you press, it will unlock.
We will test inshallah on this device.
Yeah, right? This only, this is for a practical purpose. Yes. It's not for treating for patients, it's just for showing yours. Okay? Okay, please look here. We have here load program, create program, settings, manual operation. Okay? We will first, I will show you manual operation. In manual operation, okay, we have frequency, dose, time. Understand what I'm talking? Frequency, if you want to change, see, you have to press this button. Okay. You want to change, you can increase or decrease. Understand what I'm talking? You can see? Say example, I want to put 5200 hertz frequency. Okay, set, once you set, press. Dose. Okay. Dose. For this patient, he is having open wound. For open wound, the dose should be between 0.5 joule per centimeter square to 1 joule centimeter square. Okay, he is having open wound since say 1 month, 2 months, 3 months. So I am going to put the dosage 1 joule per centimeter square.
For open wound.
Open wound. I am putting, you can put 0.5 to 1. If open wound is very, very acute, you can put 0.5.
Acute 5.
Yeah, if it is very old, you can put maximum 1. So I have put 1. What is the specialty of this? What is the specialty of this machine is that once you put dosage, automatically the time it will set.
It's programmed.
Yes.
Programmed.
Yes. Once you set the dosage, time will become automatically set. No need to put any time here. It is automatically set in manual operation also.
How much time?
The time is 1 minute 16 seconds. So for 1 joule per centimeter square, we have to give 1 minute and 16 seconds. Automatically it finishes. Okay. Now it is in lead 1. Okay. So if you want to on this laser machine, okay, we have to put here laser activated. Okay. So he is having wound here. Now I am using scanning technique. Scanning technique means we have to just keep moving the laser 5 to 10 meters away from the tip of the laser away from the skin. Understood what I am talking? So like this, 1 minute and 60 seconds, I will be treating. We should not touch because we are treating open wound. In case if the patient is having pain here, I can use grid technique. Grid means we can touch. Nothing will happen. Understood what I am talking? Grid. So I am making this pain, this problem into box grid. So I am just putting here grid for few seconds. Yeah, it should be perpendicular. You should hold perpendicular. We are using, if say example, if this patient is having, say example is having pain here, is pain here. Okay, so I am using a grid technique. Grid means I am dividing this area into small boxes. I am just putting here, touching here, okay, for few seconds.
For any area?
Pain. Say example, if the patient is coming, I am having this area full painful. Okay, so I am making it. Say I am assuming this grid. I am making in grid small boxes. So yeah, I will be touching the tip of the laser to the skin. I will be perpendicular. Okay, I will not be pressing tightly. I will be just touching it. It's a little bit firm contact. Okay, slowly and slowly.
It's okay with open wound.
Don't get confused. I said pain. Pain. Yeah, open wound we should not touch. Scanning method. Scanning. We are just scanning the wound without touching. Grid technique we can touch. If the area is large, if the area of the pain is large, we have to use grid technique. If someone is coming with, I am having only pain one area, one point.
One area.
One area. I use point application. I'll just put here, that's it. I'll just put here for 1 minute or 2 minutes according to that. Is it clear what I'm talking? Depending upon the area, depending upon how much of, say example, he's having neck pain, this much area. So I have to use scanning, grid technique. Grid means I am assuming this area as one small box. In that box, I'll be making small boxes and I'll putting this one, nothing will happen. Understood?
Yes.
Like that, I'll treat one point.
Small points.
Yeah, because laser beam comes
Yes, because the area of pain is
more. So we have to divide into grids, small grids. Yeah. Say example, if you are getting with 2 minutes, maybe 3 seconds, 4 seconds. Yeah, like that you can keep going. Understand what I'm talking?
Yes.
Scanning technique, grid technique, Wandling technique. I'll tell you what is Wandling technique, and acupuncture point application. Yeah. What is Wandling technique? Wandling technique is that, say example, if he's having pain here, say example round area, okay, mild light infection is there, okay, then I'll do Wandling is like oscillations, like a touch oscillations, like putting just like oscillations. Yeah, I'm just putting like this oscillations. That is called Wandling technique. In that also we should not touch. It should be almost 1 centimeter away from the skin.
Yes.
Okay, so that is called Wandling technique. There are 4 techniques. Commonly we use scanning technique or grid technique. When you use Wandling technique, when the laser has 3-4 beams,
not one beam.
one beam scanning, grid, point application. Yeah, many, because some of the different types of lasers will have different beams. Then we can oscillate. Understood? Like this, like a torch, you know, that is called oscillations. Understood what I'm talking? So now we'll come to load program. There's one load program. Okay, you have lot of conditions like acne, arthritis. It's already fixed. Say example, your patient is having, there are different conditions. Say your patient is having a recent edema. We can select. Okay, we can select. Automatically, the program will set everything: frequency, dose, time. We have to just
use
on the machine and start treating. Finish. Understood what I'm talking?
Yes, programmed.
It's already programmed. Yeah. You want to stop? Stop. Stop. Understood what I'm talking?
Yes.
I'll show you again. Again I'll show you. See, in any kind of electrical modality, in any kind of electrical modality, one of the important things you should understand, it's not treating with the machine, it's how you position the patient, how you arrange yourself, okay, how you arrange, how you explain, okay, how you ask contraindications, local contraindication, all those things are important. Using machine is not that important for your level 3. Understood what I'm talking?
Yes.
Using machine, you slowly will learn when you come to internship.
But the technique on the patient is important.
Technique is last. Before technique, we have to do all this procedure properly. Equal marks, equal importance should be given for everything.
Introduction.
Yeah, all those things you should do. Directly coming and owning, then that is not correct. Understood what I'm talking? It is a step-by-step process. Most of your students, when you come for exams, they'll just talk for 1 or 2 minutes and on the machine and put. That is wrong. Understood? We should talk, we should ask what is the problem, roll out the contraindications. You have to arrange the pillows, all those things. You have to arrange the machine. You have to see whether it is working or not. You have to explain to the patient why I am giving. We have to give instructions and warnings. Understood? I am going to, this is the problem, I am going to select, this is the thing. We have to we have to talk all those things and make sure that the patient should be positioned comfortably. Once we finish the treatment, we have to off everything, have to remove everything, have to put it this side, and we have to remove the pillows, and we have to check the area and note down what treatment we have given, and we should tell to the patient that come tomorrow or day after tomorrow for the further treatment. All those things, understood? We have to terminate, we have to wind up. No one will does, just they leave like this only and they go. Dr. Kalas, I can't give marks. We have to do everything very sequence way. We have to say thank you to your patient, you are the model, he has helped you. Say thank you. Come tomorrow, day after tomorrow. Okay, all those things we have to do from the starting. Why anyone is there? You want to go? No, if you want to go, you can go. I'll give attendance. No problem. You want attendance, I'll give you. You can go.
You want to kill him?
That's what you want, you can go. So, those things you should do in practicals. Operating machine, if you do operate wrong also no problem. If you do all these things correctly, I can give marks. Understood? Operating machine is last step. I am not saying you should not know, but you should know this also. But before this, you should do all these things. Then only we should, because treating is last. Understood what I am talking? Before giving treatment, you should do all those things you should do. Understood what technique you are going to select. Okay, what is the problem? Which is the all those things. And some people know they'll give treatment and they'll ask contraindications. Understood? Contraindications you should not ask at the end of the treatment or the middle of the treatment. Contraindications you should ask at the starting. After introducing yourself, after seeing the file, next immediate step is check for the general contraindications and local contraindications. At least you should say, doctor, I should ask this. I should ask this patient. At least you should say, these are the steps I should do.
If the patient have contraindication,
no, you should not do. You should not do any kind of electrical modality. I will say directly, see, you have this problem. If I give this machine, your problem will get more.
Yes.
So that's why I'm not giving. So please go to the concerned doctor again. Understood what I'm talking?
Yes.
So these things you should write in a paper and say, this patient is signing this contraindication, so I am not able to treat. So send to the other doctor.
Open wound from contraindication.
Open wound is not contraindication for laser.
Laser. Can you again progress to machine?
Open wound is not contraindication for this laser. Open wound is not contraindication for UVR. Understood what I'm talking? Okay, see?
1, 2.
You have to press. Okay, manual operation, load program. For manual operation, you have to press this. You want frequency. You want to change frequency. If you want to change, you press this. Box will come. You can increase, decrease, or you can increase. Once you've set, you again press dose. Dose example, if your patient is having chronic pain, maximum 5 joules or 6 joules.
5 to 6
joules.
Chronic 6 dose.
Okay, when we put 5 joules dose, automatically time will go for 6 minutes and 24 seconds.
If this chronic.
See here, dose means intensity.
Yes.
Understood what I am talking?
Intensity of the
laser beam. So we have according to dose, time will get automatically set. Is it clear what I am saying? Okay. So there is no need to worry about time. So maximum time, I should guess it will be less than 8 minutes maximum. You give maximum 10 joules per second. Maximum you can give for normal patient is maximum is 6 joule per centimeter square. You should not give more than 6. For open wound, it is 0.5 to 1 joule. For intact skin, you can give 1 to 2 joule per centimeter square. At the maximum, you can give 6 joule per centimeter square. It is there in the lecture when I am teaching. It's there all those things. Okay, so all those things you can go and refer. Okay.
So that open. Start.
But how we start the beam? Put it
See,
here?
yeah, test. Okay, you have to put here. Laser activated.
Red light.
Yes.
Now,
Stop.
now start.
Stop. You want to start? Start. Understood? Once it gets 6 minutes, then it will become normal. Now I can't because again 6 minutes is there, so I have to stop the mains.
Stop
But
from.
we can stop it and resume it from time to time.
Yeah, we can stop here. See, we can stop here. Stop now. It's not. I want again. I can start. Understood? Is it clear?
1 minute enough?
Sorry?
1 minute.
What? 1 minute?
3.
Yeah, enough. Depends. Acute. Okay, it's enough. This is very powerful. Laser is powerful.
According the
Yeah, it will go easy. Yes. According to the automatic, I am not setting the time.
أمان
See,
ليش توظف
I am
العلاج؟
not.
ما توظفت ذا زمان.
I am not setting the time. It's already, it will get set according to the dosage.
إذا اخترت الدوز الجرعة يطلع لك التايم. يعني التايم ما تغير. التايم هو اوتوماتيك. دوز كم 10.
Maximum 4 to 6 zones. 4 to 6. You can give 2. That is, open wound is different, 0.5 to 1. Open wound 0.5 to 1 maximum.
but say for the technique, what is the
It's okay. Why you want more? Yeah. Practical, I'll ask you different. Your patient is having neck pain, back pain, shoulder pain, elbow pain, knee pain, everywhere pain. Give laser. Understood? You have to position. Okay. You have to any joint, anywhere pain.
1 minute.
Not all 1 minute, depending upon the dosage.
لا تبكي. يا شباب شباب.
See, look here, please. According to the dosage, the time will automatically set. You no need to put any time. Dosage is important. You should know what is the dosage given for the laser. I told to put mobile phones in silent mode when I'm taking lecture. Next time if I see, I'll minus or I'll take the mobile. I'm saying since every class. Okay, so please put mobiles in silent mode. Because I'll get disturbance, not you people, I'll get disturbance. So, depending upon the dosage, your time will change. And there are 4 techniques: gridding, scanning, banding, and the acupuncture point technique.
can we use banding on open wound?
You can use, but the laser beam should be more. Understood what I'm
Yes,
talking?
yes.
Then we can use banding technique.
If the
Yeah.
wound is big.
If the laser beam should be 2 or 3,
سجل.
see this is only one laser beam. I can't use banding technique. I can only use scanning technique. If there is 2-3 laser beams, then
Scanning or this second.
first one is gridding. Gridding means if your patient is coming with a large area, pain, and dividing that into small grids. Understood? If your patient is coming with any kind of open wound, this laser has only one beam, then scanning. I'll put 5 to 10 millimeters away from the skin and I'll keep scanning. Banding technique. If I have a laser with 2-3 beams, not many, 2-3 beams. If your patient is coming with open wound, then I can use banding technique like oscillation types. Understood? If your patient is having only one point, I have only pain here, I'll just use acupuncture point application of laser.
And touch
Touch will be there. Understood? For open wounds, we should not touch. Other things we should touch. It should be perpendicular. Is it clear? Yes. So like that, I'll be asking different problems: neck pain, elbow pain, wound, knee pain, joints. Okay, you should give laser. So you have to position the patient properly, comfortable. All those things, whatever I have mentioned in the practical, we should explain. Then you should give the treatment. After the treatment, you should switch on. We should remove there. We should put it this one side. I have to remove the pillows. and we have to inspect the area
المريض ما
treated.
يقعد كذا.
You should ask him, you have any problem or not. Explain him, please come tomorrow or day after tomorrow.
Yes, yes.
If you have any problem, please let me know.
Can I come next week?
Not come, I should say. You should come next week. Okay.
Say thank you.
Yeah, thank you for cooperating. No, don't worry, it's starting.
Who say thank you? Your and
You also can say, I also can say. If you are patient, you can say thank you to me. If you are a model, I should say thank you to you. You are a model now, so I should say thank you. Because you have cooperated. Understood?